After preparing your client following the treatment preparation guide, we're now ready to start the treatment. The first step, working in sections, will be to cleanse the forehead. Taking some damp gauze with some cleanser on, just remove any numbing cream from the area. Once you've cleansed, you're then going to use a swab and some sterile solution, and again just wipe over the forehead area to ensure it's a sterile working area, and we are ready to begin the collagen pin treatment. First step would be to apply some priming oil, making sure you have sufficient amount to create a slide for the collagen pin. For the forehead, making sure you're starting on the lowest setting, you're ready to turn on the pin. For the forehead area, we're going to be working in one motion only, so working in a continuous flow in circular motions. You can keep contact so it's a nice fluid movement, and you can see that the speed is quite quick to ensure it's comfortable for the client. It's important to just slightly, as you can see, overlap the areas to ensure you're getting the full area covered. Once you've done one pass over the forehead, you can then take a swab. As you can see, there's slight prickle bleed, so you can just wipe over the area, which will just prevent the blood hardening and you having to remove it at the end. So once you've worked the forehead, we're going to move on to the second section, which is the temple area. For this area, we're going to work in 3 directions, so that is diagonal, vertical, and circular motions. The unique thing about the collagen pin is it allows you to go close around the eye area. So once you've done the temple, you can then actually just do a pass underneath the eyebrow on any concerned areas. Lovely. We are now going to work on the lower half of the face, so we will need to just remove the numbing cream. So again, as we did with the forehead, just take some cleanser onto some damp gauze, wipe over the area to make sure you've removed any residue of the numbing cream, followed by a pass over of the sterile solution. Once you've wiped over with the sterile solution, you'll be then ready to apply the priming oil to the area. If needs be on this area, you can actually adjust the length of the needle. The forehead will tend to be less length, and you can increase that as you go down the face or any specific areas of concern. Working on the lower half of the face, again, you can come nice and close around the eye area, and we're going to be working in the 3 directions again. And when you're going in a straight direction, as you can see, we're overlapping slightly to ensure all the area has been treated. And then for the third pass, we're then going to repeat those small circular motions. This will just ensure that the full area has been covered sufficiently. Once the cheek area has been covered, you can then actually wipe over if needed with some saline solution just to remove any prickle bleed if there is any. And the last part of this half of the face will be working on the chin area, so just removing the numbing cream with, again, some cleanser and some saline solution. We're going to work on the chin, again, in the 3 directions, 3 passes, and again, we can just wipe over the upper lip for any concerns in that area. Not forgetting the priming oil before we begin. With the upper lip, as it's a smaller areas, you can just do a couple of passes, ensuring that you're covering the full area, getting close enough to the lip line to treat any causes of concern around the area. And that is one half of the face. Once you've completed that half of the face, you can remove any excess oil and prickle bleed from that area, and you are ready to repeat exactly the same steps on the second half of the face. Once you finish the second half of the face, you can then continue to follow your treatment preparation guide, which will allow you to finish with the correct products, which will be your priming oil and your medical barrier cream.